Welcome back. Well, we mentioned how we're all sporting red today. It's Wear Red for Women Day, calling attention to heart disease, especially in women. Sara Hegarty joins us from the American Heart Association. Good morning. You got your red on too, of course, this morning. We're all doing that, getting on social media, using the hashtags today.
Absolutely. We have to sport our red for awareness.
Yeah, let's talk a little bit about, women and heart disease, because I think, women, we're taking care of everybody else. We're busy, we're doing all the things, and sometimes we kind of put ourselves at the end of that to-do list, right?
Absolutely. We want to make sure the kids are fed and that our spouses are on their way and people at work are taken care of. And we put our needs pretty much last. And that is why heart disease is the #1 killer of all women. And that's above all forms of cancer combined.
But we want to talk about, the prevention here, because heart disease, we can prevent it. So what are some things that we should be thinking about today?
Yes, absolutely. We want to make sure that we are knowing our numbers, getting those routine checkups. There's only so much we can do without knowing our family history. And so that plays a very important role. And then, lifestyle changes, eating healthy as much as we can, exercising, those small changes do go a long way. And stress. I cannot stress that enough. Managing our own stress is going to help our cardiovascular health.
Oh, that's the toughest one, though, Sara.
I know.
So just find those ways, to make time for your mental health and to take care of that stress in your life, ladies. Yeah, we're talking to you today. Let's also talk a little bit about symptoms as well, because it could be a little bit different for women than for men, but, we do want to talk about symptoms overall.
Yes, absolutely. Backaches are very common with women, upset stomachs, dizzy, feel like you're going to faint, and heartburn. Those are very common symptoms. For women, they don't typically get the tightness in the chest or the left arm. It can present very differently. And so advocating for yourself at the hospital, and don't be afraid to call 911. That is, a huge chain of survival, is making sure that you get help right away.
We're showing that Be the Beat on the screen, and that is one of the things that you want to make sure that we're getting out there, on this Go Red for Women Day. Really for everybody, though, when it comes to heart disease.
Absolutely. Knowing hands-only CPR is a huge benefit to everybody in your home. Cardiac arrest happens outside of the hospital the majority of the time. We're talking like 70% of the time. And that, out of that clump, it's probably going to happen at home. So knowing hands-only CPR, you're most likely going to use it on somebody you love and know. And so we have a great video up on our website that just takes about 60 seconds to do. There's 2 steps. You want to call 911, and the second step is to press hard and fast in the center of the chest. We want to aim for between 100 and 120 beats per minute. And think about some of your favorite songs. I mean, the Bee Gees' Staying Alive is a very popular one, but think about Miley Cyrus's new song Flowers. That fits as well. So lots of songs fit between that 100 and 120 beats per minute.
Yeah, I've been hearing that one on the radio a lot lately, so there you go. There's been, we've been talking about heart disease a lot lately in the news with Damar Hamlin, raising awareness for that. Have you noticed that people have been stepping up to the plate more in trying to learn a hands-only CPR?
Absolutely. The video that we have up on our website, people have visited it 600 times more than the regular traffic.
That's great.
It is, when you see something happen in real life and in real time, #1, it's traumatizing. But #2, it makes you realize that nobody is immune to this. A young athlete suffered cardiac arrest in front of the nation. And so nobody is immune to this. And so talk about preventative care, making sure that somebody in your house, multiple people in your house know CPR, it's a huge step in the right direction.
Yeah, and you could see just the difference that it made, having someone right there to jump in and get going on that right away. And he's doing great today. So what a testament there to learning that. So, today we want to make sure wearing that red, get on social media. What hashtag should we be using today, Sara?
Go Red Toledo. Hashtag Go Red Toledo.
Very good. And we got our red on in our pictures here today, so we'll be doing that throughout the day. Sara, thank you so much for joining us this morning.
Thank you.
Yep, take care.